Hello, Assalamu alaikum. Thank you so much for inviting me to this really important conference. And I'm talking about climate resilience and why we should be optimistic as well as recognizing the pessimism of our current situation. This is the problem. We have greenhouse gases that are trapping solar radiation energy more than they should, and it's affecting every aspect of human life and planetary life. And the energy trapped is enormous. If you look at it in terms of Hiroshima bombs per second, the equivalent energy, it's been steadily rising. It's happening at about, well, some people estimate above 11 bombs per second. And that's why our Earth is warming up. I'm going to talk about Lancet countdown indicators and about 8 things that I think health scientists can do to build resilience and address the climate crisis. I got involved in 2007 when I went to a Royal College of Physicians conference and realized from climate scientists how bad the situation was, which I haven't really thought much about. And Richard Horton rang me up a week later and said, would the new Institute for Global Health do a commission? And I knew nothing, but he said, mobilize your universities. So I went round and we spent 2 years chatting about this, and we published the first commission with a strapline, climate change is the biggest global health threat of the 21st century, and it got a lot of media attention at the time. And I was very worried about what would happen to all my colleagues in South Asia and their populations, and also my own children. Not much happened after that. And 4 years later, we thought maybe we should be doing something else. And so we did another report, this time saying climate change, everything you do for climate change is good for global health, clean air, physical activity, better diets, etc. But this time we said, let's do a countdown. And Richard agreed, and so every year we produce a report. We've now got not just UCL, this is an international collaboration, and we put out reports that are freely available before the COP meetings in October each year. So do download for free the 2025 report. So there's 71 contributing organizations from around the world and more joining all the time. We have 5 working groups: health impacts, health adaptation, health benefits of mitigation, economic impacts and transition, and public and political context. We have a conceptual framework, which I won't go through, but you can see the links between climate change, meteorology, extreme events, other impacts, and health, and the social mediating factors. And on the right, these are examples of the indicators we're looking at. Those are just for Working Group 1 on impact. So let's go through a few. If you look at exposure of vulnerable populations to heat waves, we can see that there has been a steady increase and almost an exponential rise over the past decade for both infants on the left and individuals over 65. Both groups are vulnerable, and we've got a big problem. At the same time, physical activity is affected in terms of hours per person, much more in lower middle income countries where there's a lot of work outside in very hot weather, agricultural work, construction work, etc. And this has a big economic impact. If you look at the yellow bars for lower middle income countries, the agriculture is yellow, the grey is construction. This is a huge GDP hit, not just to individual households, but to nations as a whole, and it's getting steadily worse. In fact, not steadily, it's accelerating. Heat-related mortality modeled by a German group and by a London School of Hygiene group shows that deaths are steadily increasing, and at the moment it's around about 500,000 deaths annually. I think that could well be an underestimate, and it could accelerate very sharply in the not distant future. we are already above 1.5 degrees. And if it's higher this year, you need 3 years on the trot. That will be confirmed. This is Stefan Ramsdorff, who's looked at the one blue spot in the world where we're not warming because of Greenland melting. That's disturbing the Arctic snow, which is falling in America right now. But what it does do is it interrupts this circulation in the Atlantic, AMOC, or we call it the Gulf Stream, which keeps Britain and Western Europe warm. We're on the same latitude as Alaska. But that could be blocked within 20 years, according to some scientists, maybe longer. And that will have a big impact on Europe and parts of North America. But he published a paper a few months back with a colleague showing that he thinks the IPCC estimates are wrong. We're heading up to 2 degrees in 12 years' time. We're heading up to 3 degrees in 34 years' time, and a devastating 4 degrees by 2084. And IPCC are currently looking at these issues. Infectious diseases. We know that vectors are more likely to spread in warmer weather, and this affects viruses such as dengue, chikungunya, yellow fever, Zika virus, and many others. This is what worries me more. Huge numbers of people in the world are hungry. It's got worse since 2015. There's an association between the number of heatwave days and reported food insecurity, as well as drought months. And the latest global report on food crisis 2025 shows that all pillars of food security, availability, access, utilization, and stability are being affected by climate change. And this is Pakistan. And if you look at the 2017 column at the top, the orange and red add up to 2.7, 1.3, 1.4. In 2023-4, those are 9.6 and 2.2. So there's been a very dramatic shift of numbers of people through acute food insecurity, particularly in Sindh and Baluchistan, and a little bit in Northwest Frontier Province. So Pakistan is affected. I should add that in the UK, 23% of our children live in food insecure households, mainly because of food prices and food inflation. But this is more of a climate effect. Good news, cities are better than national governments at doing risk assessments and thinking about what to do. Mayors and cities tend to be closer to their populations, so you don't get the kind of nonsense from the United States where the president says it's all a hoax, and states are actually a lot of states, mainly blue states, are doing a lot of good things. Urban green and blue spaces, we're not really changing over the past decade, and we need to do much more. It's important for children to play, it's important for shade and protection, and we need a lot more trees, and we can do that in urban as well as rural areas. The broken line here is the carbon intensity of the energy system, which shows that the share of fossil fuels in the global total energy supply, although that's fallen since 2016, it's still 2/3. And the broken line shows the carbon intensity, which has barely changed because although very high income countries, purple, it's coming down, and a little bit in high income countries, the top one, others are increasing. So we really must invest so much more in solar and renewable energy and wind, particularly in South Asia, for example, and sub-Saharan Africa. And I think that's starting to happen with cheaper Chinese solar products. We are subsidizing fossil fuels massively, and we're not applying a carbon price. We are letting the polluters off the hook. Polluters should pay, and they should clear up their mess. And that's not happening. And we can see it also that on the left, you've got fossil fuel investment, which remains pretty static and has had a surge in the last couple of years. Green investment has gone up, but it still is being topped by fossil fuel lending. And the fossil fuel companies are getting messages from politicians and bankers that everything's all right, we can forget about net zero, and they're massively expanding production. This is all bad news. Now, indicators are one thing, but accountability means to monitor, to review, and to act. And my question is to my colleagues often, what's our duty beyond just collecting indicators? And I think that's what I'd like to address. Firstly, for multi-sectoral action, it's critical to address an advanced climate crisis, especially for children. So in our report that we published in 2020, again, freely downloadable, A Future for the World's Children, all ministries contribute to child health and protection. Road injury is the leading cause of death, transport, agriculture and trade affects all kinds of nutrition and diet issues, urban planning for play spaces, environment, massively important to stop air pollution, etc. Likewise, family services to protect against domestic violence and stress. Housing, Helen Clark, our chair of that report, she was very firm that if you don't address housing, you're not going to solve a lot of health problems. And education has greatly increased school attendance over the past 20 years, but is the quality of education and their outcomes really good enough? So what do? We have to collectively do this through government, through corporations, businesses, universities, hospitals, and individuals. And it's not a cost, it's a saving, because we have to save our planet and our environment. And there's so much we can do. So that's why I want us all to stay optimistic. There's no point giving up and saying, oh, other countries aren't doing it, so we shouldn't either. So first we must lobby for solutions, and I won't go through this because I think all of you know that the government actions for net zero emissions are fairly standard. I mean, it's on energy subsidies, transport, how you build, rewilding, particularly sustainable agriculture, which accounts for a third of emissions, and moving businesses green. And we need to do a lot more on policy implementation, thinking about scaling up, supporting champions, implementation science and quality methods, and above all, communities. I'll come on to that. And all of you, if you look at that list, I think all of you in the conference would tick at least 2, maybe 3 or even 4 ticks. So you are leaders, all of you. You have a role in inspiring people and leading change and in ensuring good governance wherever you work. And you can do that. In Pakistan, there are fantastic people working in the hospital sector, with lady health visitors, with other forms of community work, and particularly with local leaders and religious leaders. The NHS has its own guidance now about carbon reduction and supply chain rules. The Lancet is publishing another commission on sustainable healthcare later this year. Medical products and technologies in the West are generally terrible, with too much single-use plastics, not enough recycling, high carbon inhalers, anesthetic gases. A lot of people are saying, why not just move to intravenous anesthetics? And obviously lots of low-value care, which probably contribute 80% of many of the emissions in hospitals. But I'd like to go on to the community. I've been working recently with a primary care trust in London and linking general practitioners to community through social prescribers, neighbourhood navigators, local NGOs, and linking in the secondary prevention of GPs to the primary prevention of community workers, and emphasising all these different factors, not just activity and better diet, but heat stress, clean air, biodiversity. I've been involved in a lot of trials over the years looking at women's groups and how they can reduce neonatal mortality by 30% in even the poorest areas through participatory learning and action, and also involved in an interesting study in Pakistan. I beg your pardon, Bangladesh. What am I thinking? And we're comparing community groups to prevent diabetes, basically, and pre-diabetes. Community groups versus mobile phone messaging versus control villages, 32 villages in each. And we showed a very big cut, 64% in the prevalence of type 2 diabetes and intermediate hyperglycemia in the participatory learning and action groups, with a 21% absolute reduction. So this is important. But I don't need to preach to you. Pakistan has a very strong record in very high quality community trials published in international journals. And these are three recent ones: Mother and Newborn Care Package, the CLIP trial, and the excellent comic trial published by Professor Jai Das and colleagues. So you're very much world leaders in this area. This is from Nepal. A colleague of mine set up a program with school children, and the teachers and children were given apps to add to their phones, enabling them to map their environments, to look up their plants, their pests, and they all went around doing this for a few weeks, and they absolutely loved it, as did the teachers. And this is what they found. They found an enormous number of crop pests and problems such as landslides, failed crops, flash flooding, more in Jumla in the Himalaya rather than in the Middle Hills, but all had the problem. And thinking about how this kind of mobilization and information could feed into community groups, and also maybe linked to satellite data. For example, you can get free satellite data now, down to about 10 square meters, looking at green growth, so the strength of your crops, and also water provision, and also, if you do a little bit of standardization, carbon sequestration, which could be very interesting, because if you can show that you're sequestering carbon, then a lot of banks will invest in this program at scale. Mental health. We've just had a little workshop about this because we don't have an indicator on mental health, and it is a problem. I've just read some interesting articles in this rather obscure journal about the emotional catastrophe being visited on the next generations, and I think this is correct. A culture of uncare, as they say, and I think we need to think very hard about how we mobilize, and perhaps through the religious authorities as well as schools. This is the middle picture is of a 9-month-old child born to a Muslim mother, and another baby there who's 2 months born to a Christian mother but a Jewish father, and they're my grandchildren. And if they live to be my mother's age, she died 18 months ago, aged 100, they'll live to 2,125. And I adore them, but I'm very worried about their future. And I think we all should be. And I think we need to challenge bankers and the rest of them, and politicians and the military about this. Future generations commissioners. There's only one in the world that I know of, Sophie Howe, who works for Wales government, where she was asked, having asked them what they wanted their government to be able to achieve, and these were what they listed. She said, well, look, how can I help review your policies so that they're going to protect children in future? And she's done it for 10 years, and she's had both successes and defeats. But I think getting commissioners into the decision-making process would be a very interesting initiative, and I'm very keen to see that happen. Maybe Pakistan could pioneer it. And finally, the military. We all have militaries. Pakistan has a very powerful military. And of course, you need a military to defend you, particularly in a tricky area like where you're based. But a lot of the military people are talking about this. How can you bring mitigation and adaptation into their existing strategy? How can soldiers adapt to providing proper humanitarian assistance and disaster relief rather than just shooting? And thinking about this future relationship between military if there is climate breakdown. And this is a report that just came out 3 months ago or something in the UK, which the government tried to keep rather under wraps. This is the intelligence chief saying, look, a looming collapse of ecosystems with food shortages and disaster just years away. So those are some of the ideas that I think you all need to think about, and I'm sure many of you are already doing that. And we all have a duty to bring this into medical education, to inspire all the people we work with. And it's not going to be easy, and it's slow, and it can be depressing at times. But I think there is a mood, particularly young people, to try and undo the damage that's been done by my generation's work. So I'll leave you, and thank you very much. I love to be with you. I've loved my trips to Pakistan, and I'll leave you with Qaidi Azam saying, with faith, discipline, and selfless devotion to duty, there's nothing worthwhile that you cannot achieve. Thanks very much.